Clinical research and trials are the only way to determine the safety and effectiveness of a new medicine, device, and even diagnostics that treat illness and save lives. Dr. Charles Drescher joins us to discuss the research that Swedish is doing around gynecological and breast cancers. Thank you so much for being with us.
It's a pleasure. Thank you for having me.
Now, before we dive into the specifics, can you tell us kind of zoom out and what is happening right now broadly with cancer?
Right. You know, it's really exciting time to be involved in cancer research. There's just so much going on, and it's largely occurring as a confluence of advances in technology and biotechnology more specifically, but then also computational biology. All of this combined and interacting together makes it possible for researchers to contemplate and even develop technologies and interventions that weren't even considered possible a few years ago.
I mean, when you think about, you know, the targeted therapies we have now.
Right, perfect.
By the way, what is computational biology?
Yeah, computational biology is a very broad term, but it's basically the idea of managing very large pieces of information driven from biological processes, and then trying to interpret them in a way that leads to a greater understanding of how things work.
Because we have so much data nowadays.
Exactly.
And how do we gather it and put it into place? All right. Well, tell us about what you're currently working on in your work with gynecological cancer specifically.
Yeah, great. Thank you. So the gynecological cancer research program at the Swedish Cancer Institute is one of the largest in the region and actually one of the largest in the West Coast. At any given time, we have 10 to 12 research trials open. Most of those focus on some of the more common gynecological cancers, such as endometrial and ovarian cancer, but we also have clinical trials for cancers such as cancers of the cervix and vulva and vagina. Now, our trials span the whole spectrum from what are kind of commonly known as phase 1 studies, which is essentially really trying to figure out what's the best way to give a medicine very kind of early on, all the way to phase 3, where these are medicines that have been pretty heavily tested, and really the question is this medication going to be better than what's the current standard? So this is work we do in clinical trials, but we also have a translational research program trying to really understand the biology, what drives the development of cancer, and trying to understand why cancers become resistant to particular types of therapy. A lot of this is being accelerated by the recent opening of the Paul G. Allen Research Center at Swedish Cancer Institute.
So great.
Yeah, it's really going to be fantastic.
I think it's so amazing, and a lot of people I don't think I realized until a while ago the broad spectrum that Swedish has. It's not just for administering a clinical trial. We are starting, like you said, at phase 1 in the idea phase of so many of these things. Let's talk about breast cancer. You are working on the TMIST study trials. What is that, and how will it help?
Yeah, great. So mammography's been a critical tool for breast cancer early detection for probably 5 decades now. There's really good data that conventional mammography reduces breast cancer mortality and makes cancers diagnosed at an earlier stage. The conventional approach to mammography is what's known as 2D mammography, and in that test, the radiologist takes 2 images perpendicular to one another, basically, in order to then look at the breast tissue and look for early evidence of cancer.
But TMIST is different?
TMIST is different. TMIST is comparing standard 2D mammography to a newer approach called 3D mammography, or tomosynthesis. Now, tomosynthesis isn't entirely new. It's actually available in the community.
Yeah, right now you
it's
can
FDA
get it.
approved.
But that's the question people have had for years. Is 2D better than 3D? I'm glad someone's trying to figure this out.
Yeah, right. It's a really important question. So that's exactly what TMIST is intending to do. Is tomosynthesis better than 2D mammography? And if it is, and what are the specific situations in which it performs better?
TMIST, I know there are a lot of ramifications and good things that could come out of this. How do you see this work helping underserved communities?
Yeah, very important. So we know the burden of breast cancer is not shared equally. The American Cancer Society just reported that Black women are more likely to die of breast cancer than any other cancer. And potentially even more alarming is the fact that breast cancer mortality among Black women relative to Caucasian women is about 40% higher. even though the incidence of breast cancer is lower in the Black population.
Yeah.
Now, there are lots of reasons that contribute to this. There's evidence to suggest that the biology of breast cancer is different in African American women. There's also evidence that there's variations in treatments. But access to screening and early detection is also an important
key.
factor.
It's so key.
Yeah.
Thank you so much. I really appreciate it. I really appreciate your time in explaining all this and all your work. Thank you, Dr. Drescher. We will hopefully talk to you again soon.
Okay, thank you. My pleasure.
And if you all want more information about the work that Swedish Cancer Institute is doing, visit the website you see on your screen. And an important reminder, whether you've been putting off care or you need to follow up, be sure to reach out to Swedish Primary Care today to get and stay healthy. Y'all, in the mid right now, I am late for my mammogram, and this was my reminder to go and see my radiologist. All right, thank you. Well, coming up next, we are talking about our neighbors to the north, Canada. One of our team members just visited for the first time, and we've got some hot takes. Stick around.
This portion of New Day Northwest is sponsored by Providence Swedish.